what's the difference between a physical therapy assistant and a physical therapy aide? Well, in this video, I'm going to be discussing the differences in schooling, salary, and roles. Lego. Aloha! What's up everyone? My name is Justin Lee, Doctor of Physical Therapy student and fitness coach. Here you'll find videos on fitness, physical therapy, and lifestyle that helps inspire self-change. I truly believe that lifting not only weights, but also each other can help empower greatness and encourage excellence. So whatever journey that you're on, just know that I'm here to support you and here to lift you up. Change people. That's why we live for change, people. If you resonate with this, feel free to subscribe and hit those notifications. All right, so 3 parts in this video. Number 1, we're going to be talking about the schooling of what's required for each of these roles. Number 2, we're going to look at the salary differences. And number 3, the big one, is going to be the roles and the differences between a physical therapy assistant and a physical therapy aide. All right, so number 1, the schooling. What's required and what's the differences between an assistant and an aide? Okay, so a physical therapy assistant, you need 2 years on top of your high school to get your associate's degree. And once you get your associate's degree in physical therapy assistant, you also have to take a licensing exam to make sure you're competent in making sure you can treat other people. Now, after all this is done and after you do all of that schooling, you have to continue your education with continuing education units, and that's something that you have to renew every 2 years. On the other hand, with a physical therapy aide, you only need a high school diploma or a GED, and that's it. So as soon as you graduate high school or you get your GED, you can just go to any clinic and ask them, hey, can I volunteer or can I work as an aide? And then they just look that you have your high school diploma and boom, there you go. Now you become an aide. Okay, number 2, the salary. What's the differences? Now, obviously the schooling, like I talked about, you have an additional 2 years to get your associates, hopefully 2 years, right? I mean, it's so impacted nowadays, but hopefully an additional 2 years to get your associates versus a high school graduation. So of course, being an assistant, you're gonna get a lot more money versus being an aide, you're not gonna get so much. So typically, the annual salary for an assistant, a physical therapy assistant, is about $50,000, $50K. And then for a physical therapy aide, the annual salary is about $20,000 or $20K. So you can obviously see the difference of schooling and how much more money you make as an assistant. If you guys are already getting some value from this video, feel free to give this video a nice like. And if you know anyone who's an aide right now or is trying to be a physical therapy assistant, feel free to share this with them. Or if there's anyone on the student network or any forums that have any questions about this, feel free to share this with them as well. All right, let's get into the different roles of a physical therapy assistant and a physical therapy aide. Okay, so the biggest thing that you just need to remember when it comes to a physical therapy assistant and a physical therapy aide is that an assistant can actually help and treat patients. An aide is not so much. They can't really help and treat patients and be a part of that plan of care. The physical therapy assistant is the one who's actually treating them with manual therapy, maybe some modalities, maybe some therapeutic activity. They're the ones that are gathering the subjective exam from them. They're the ones who are actually taking objective measures and then actually writing and documenting about everything that they've done. On the other hand, a physical therapy aide is typically not treating any patients. Now, I'm gonna get into this later, but it does vary from state to state, and I'm gonna go over that and dive a little bit deeper in about that. But generally, a physical therapy aide is just there to help keep the clinic nice and pretty, is to pretty much prepare the patient to see the physical therapy aide see the physical therapy assistant or the doctor of physical therapy. They're getting some equipment ready, making sure everything is clean, cleaning the tables, maybe some other duties like doing some laundry and making sure they have enough towels or the hot pack and cold packs are ready to go and things like that. So as far as responsibility goes, an assistant has way more responsibility, and yeah, they are a licensed professional. That's a huge deal. They have to get a license. So there is a ton more responsibility with a physical therapy assistant versus just an aide that does not need a license, and they should typically not be treating any patients. But let's get into that. What are the differences in what a physical therapy aide can do and what's their scope of practice, and how does it differ from state to state? All right, so this information is coming from the FSBT, the Federation of State Boards of Physical Therapy website, and I'm using this to compare different states and see what aides can do and aides cannot do. And I'll put that in the description as well. And of course, in the description, I'm always putting timelines and a little brief summary of what's going on. If you guys didn't know, I always do that in all of my videos, so make sure you always check out the description because there's always a ton of value there as well. Okay, so let's take the state of Pennsylvania, for example. Now, as you can see, the scope of practice of what an aide can do in Pennsylvania is that they can only clean, escort patients to the treatment area, and then set up exercise equipment. Now, anything else outside of this is outside of their scope of practice. And so, if you're in the state of Pennsylvania and you see an aide do anything outside of this, that means they are not allowed to do that. And if they are doing that, then there might be a problem at that clinic. Yeah, I don't want to be involved in any of that stuff. If I was an aide, I want to know what my responsibilities are, and if I do anything, if my director or owner or a physical therapist tells me to do anything outside of that, yeah, I would feel pretty unethical doing anything like that. All right, but then, however, instead of Pennsylvania where you have a limited amount of stuff that you can do, conversely, when you look in Nebraska, the scope of practice of an aide is pretty large. So let's see what that's about. So in Nebraska, an aide can do all of those things, but they can also do massage, they can do manual therapy techniques, gait training, and also assistance with donning, doffing, braces, orthotics, prosthetics, and more. So let me ask you, does having a bigger scope of practice, aka more responsibility as an aide, make you go yay or nay? Does that make you happy, or does that make you like, ooh, that's a lot of responsibility for somebody who's just graduated high school and they can do all those things? Who knows? Let me know in the comment section below. All right, so that was Pennsylvania and Nebraska, two very extreme ends. I live in California, so let's see what California has to say. So as you can see, there are no checks in California, but instead it says no data is provided. Now, what the heck does that mean? No data provided? So does that mean I can do something or I can't do something as an aide? What are my actual responsibilities? Like, what is within my scope of practice? So now let's actually look at the California law and regulations and see what they have to say about what the scope of practice is for an aide. And once again, I'll put in the description below on the laws and regulations for California and the scope of practice for aides. Okay, so I just want to take a step back and just give you a little bit before we go into the text. But basically, when they talk about the responsibilities of an aide, it's pretty damn vague, okay? So just stay with me and then I'll explain about all of that here after all of that. Okay, so let's look here on the California Code of Regulations on the requirements for supervision of a physical therapy aide. All right, so as you can see, it says a physical therapy aide is an unlicensed person who may be utilized by a physical therapist in his or her practice by performing non-patient related tasks or by performing patient related tasks. Okay, so they can do non-patient related and patient related. What the hell does that mean? Okay, so they define a patient-related task means a physical therapy service rendered directly to the patient by an aide, excluding non-patient related tasks as defined below. And then they describe a non-patient related task means a task related to observation of the patient, transport of patients, physical support only during gait or transfer, housekeeping duties, clerical duties, and similar functions. Okay. So that's what I mean by how vague it is. So that is like super confusing, and you're probably like, whoa, what is actually the role of a physical therapy aide and the responsibility? And yeah, that's why I told you it's pretty damn vague. So just to sum all of that up and how super vague it is, there's a general rule of thumb or thumbs here in California. And so we know that a physical therapy aide is an extension of a physical therapist or a physical therapy assistant. So no matter what, whoever the aide is under, they are an extension of that person, so of that day, right? So you as a physical therapist or a physical therapy assistant, you want to give some roles to the aide, and you want to make sure that the aide is competent enough to do some of those roles. Now, if they are not competent enough and they mess up or they injure the patient or anything like that, it is the responsibility of whoever is in charge of that aide to be responsible for that patient. Yeah. So you have to make sure you build a good relationship and you have a good understanding of what the competency level or the skill level that the aide has. And you as a PT or a PT assistant want to definitely make sure that they are able to carry out those tasks efficiently and responsibly. So all in all, there are pretty good differences between aides and assistants and what their responsibilities are depending on state to state. So what does that mean for you as you're emerging to be an aide, PT assistant, or a physical therapist? Is that you should continuously check your laws, your regulations, your responsibilities, your scope of practice, depending on what state you're at, and then make sure you check it annually to see if there's any updates. Because at the end of the day, yeah, this video gives you a brief overview, but don't trust this video 100% because the laws and stuff can change on a yearly basis. And unfortunately, that's just the way things are. But I hope this video already has given you some value, at least a general understanding of the differences between a physical therapy assistant and a physical therapy aide. So I hope this video helped inspire some self-change to take steps forward to becoming a physical therapy assistant and not really be stuck as a physical therapy aide. I know I made this video a little bit even playing field. But honestly, if you're gonna be an aide at this point, I definitely would not make that a career for the rest of your life. I hope that you have high aspirations to becoming a physical therapist, a DPT, or a physical therapy assistant, either or. And that reminds me, if you do want a video on the differences between a DPT versus a PT assistant, let me know also in the comment section below so I can make that video for you guys. All right, you all. Change people. That's why we live for change people. Stay lifting. Have a great one, you guys.